Hey there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider. Happy Sunday. Thank you so much for joining me. In this edition of Integrative Movement Insider, I want to share with you the three primary functions of the Glute Max, because if you work with the older population like we do here in our clinic, and we just shared with the Functional Aging Institute Mastermind group down in Houston, Texas at my friend's clinic, the Evolution Fitness and Wellness, Jackie Bachmeyer and her husband Jason Eichen. We shared some of the basic concepts of anatomy, functional anatomy, physiology, things like that. The reason why that's so important is so that you know how to, number one, assess your clients, number two, use the most effective corrective exercises, and number three, how to functionally progress your clients so that you help them improve their balance, their strength, their coordination, their agility, and the ability to do the things they need to do for everyday life and function. So I want to share with you, again, the three main functions of the Glute Max. We all know that, we should know, I should say, that the Glute Max, the primary function of the Glute Max is hip extension. So I'm going to talk about mostly that function here today, but I just want to share two other functions. The second function of Glute Max is to control us in the frontal plane. We hear about the glute medius being the primary frontal plane controller, but it's actually also the Glute Max and the TFL, where they attach down into the iliotibial band, which goes down to the outside of the knee. So what happens is when you stand in single leg, excuse me, these two muscles contract and pull that IT band tight to keep us stable in single leg stance. So it's a Glute Max plus the glute medius, not just glute medius. However, the third function is also rotation. When we stand in single leg or we're progressing onto our single leg, the Glute Max will also, again, pull on the iliotibial band and help control rotation of the pelvis in the transverse plane. So that way, we're also using the transverse plane function of the Glute Max when we're walking, standing, and also doing balance work. So what we want to look at is how do we maximize our glute training so that's doing what we want it to do. So I'm going to focus on the hip extension function, and also on Tuesday, Jill and I, the two anatomy geeks, we do our anatomy series where we cover functional anatomy as well as where the muscle is, how to palpate it, how to look for it, and then also some corrective exercises around that. So join us Tuesdays at 12 o'clock Central Time. For this week, we're going to talk about the Glute Max, but today I just want to share with you a couple the three simple exercises that we use to improve Glute Max in our clients. Now, how do we best train hip extension function in our clients? The way we do not want to train it is what most of us have been taught to do. What we do not want to do is we don't want to come out of our squat, lunges, deadlifts, and go into this excessive hip extension pattern. Because if we think about our older client, in the last two editions of Integrative Movement Insider, check it out on our website, IIHFE, or our Fitness Education Seminars website on YouTube, or I should say link on YouTube, I talked about why so many of our older clients are in posterior pelvic tilt, which is essentially already a hip extended position. So teaching them to do more of this is not appropriate or is actually ineffective and will create more issues for our clients, because the number one thing we want to do during our exercises to improve glute max function, which will improve low back issues, knee issues, and also hip issues, is teach them how to get anterior pelvic rotation, which is this motion right here. We need to teach them how to anteriorly rotate their pelvis, not just shove their hips back like that, because that's not anterior pelvic rotation, that's just posterior translation. We need to rotate the pelvis anteriorly to maximally use or create effectiveness of the Glute Max as hip extenders. Because the anterior rotation, the stretching of the Glute Max and the posterior fascia of the hip complex is ultimately what helps bring us back up, which is ultimately what helps drive us forward as well. It's the loading and then the unloading that allows us to maximize function of the hip and also improve function of the hip, knee, ankle, and foot complex. So, first thing we need to do is release the posterior hip complex. You know how to release the posterior hip complex, but make sure you get the attachments of Glute Max and those deep external hip rotators high up in the glute region of the posterior hip complex. Now, the first exercise we teach our clients, or I should say one of the first exercises we teach our clients, is how to do a hip hinge bridge. I'm going to get down on the floor here, demonstrate what that looks like, and why we don't do the rolling bridge for our clients. There's nothing wrong with the sort of Pilates or that sort of articulation bridge, nothing wrong with it for spinal mobility and hip mobility. However, our clients need to learn how to control their thoracolpelvic cylinder, how to lift up putting their weight down towards their feet and then hinge through their hips. So the first thing that comes off the floor is their hip, and the last thing first thing comes up is hip. The first thing that touches down as they come back down is the hip. It's not this, and they shouldn't be pushing themselves back like this, which happens to a lot of our clients because they're trying to use a knee dominant strategy and just extend and use your quads to push themselves back. So again, it's align their thoracolpelvic cylinder, keep the thoracolpelvic cylinder aligned, lift up, hold, come back down. First thing that hits is the hips. The reason I elevate the legs is because most of our clients, their tibia are not long enough to get any motion, so they end up just pushing themselves back because they don't have enough range to work with. So elevate the feet so that they can have more range to work with and really focus them on the eccentric or that hip hinge portion of their exercise pattern. So that's the first pattern, or one of the major patterns we use with our clients to improve hip hinge function. Now we also have to teach the hip hinge function in the upright position. So there's a couple different ways to do that. One of the best ways to do that is actually with a bench. I'm going to use these steps as my bench. I was just demonstrating this with Jackie's trainer this past weekend. Is one of the things you want to do with your clients that are stuck in posterior pelvic tilt is teach them how to get long, stack their thoracolpelvic cylinder, and just position them on the bench. Their first motion is to feel as if they're pulling the floor apart this way with their feet, and then hinge forward. So rock forward, hinge forward, hands on the pelvis, and then stand up. And then the first thing to do is anteriorly rotate their whole entire cylinder to sit back down to the bench. Obviously, they're going to use a higher bench than I'm using because their range of motion in their hips won't be as much as I have from the majority of your clients. So it's hinge first, hands on the pelvis, but hinge the entire cylinder. Feel like you're pulling the floor apart this way between their feet, and then lift up, and then come back down and reset, coming back up. Great way to teach the hip hinge and ultimately a squat position, because even though a lot of your older clients, their feet their knees bother them when they squat, they need to sit down, yes? They need to sit on the toilet and get off the toilet. They need to sit in lower chairs and get off those lower chairs. Great way to teach them how to do that. Now the third exercise for the Glute Max to improve hip function is the hip hinge pattern, or I should say the stiff-legged deadlift, which is a progression from the hip hinge pattern, and also in the split stance. So I'm going to go into split stance hip hinge with a little bit of resistance here. I'll use a kettlebell for resistance. But again, it's really about now controlling rotation as you go into split stance. So what I want to have my client do is be in the split stance position, but they start with their feet parallel because I want to make sure they start in a squared up position. What our clients tend to do is when they move one leg back, they're rotated, and now they're trying to do their hip hinge like this, their split stance hip hinge deadlift like this, and they wonder why it bothers their low back, because they're not getting, again, the squared pelvis and the anterior pelvic rotation. So again, it's very deliberate how we set our clients up. Long spine, stack that rib cage over top the pelvis, hands on the pelvis, then is a hinge here, then step back so you know your client is squared up, and now we can have them hold the resistance, and now is drive up towards the ceiling this way, not bringing the pelvis this way. Don't thrust the pelvis forward this way, drive up towards the ceiling, and then control the eccentric phase on the way down, not allowing the client to rotate out of this position. So they should not look like this as they're coming down. They should be able to stay square. So reset myself, stay square, step back, still staying square, so square across my belt line, and then come up and then stay square on the way down because I'm creating pure anterior pelvic rotation. This is the most effective exercise, in our opinion, to help clients really start to learn how to mobilize their hips, use their glute appropriately to control the eccentric phase as well as the concentric phase, to teach them how to get the pelvis to rotate this direction towards their forward leg, which is what walking is all about, to use their glutes to minimize stress on their knee, their hips, their low back, and really set your client up for success as they do the functional activities of everyday life. So give those 3 exercises a try with your clients. Make sure they're appropriate for your clients. Make sure you've done your release work. Make sure you've done the exercises that help lead up to these exercises. So some of the progressive exercises, or I should say corrective exercises that help make these exercises more effective. Keep your clients aligned and controlled through their exercises. Don't allow them to do exercises where they're shaking all over the place and they're compensating and they're going right back into their habitual patterns. And you will really be that resource for your clients. And like I said, you'll really change clients' lives, because there's two patterns I believe that will change clients' lives. Number one is breathing. Number two is teaching them how to use their hips appropriately. So give that a try. We'll see you next time at Integrative Movement Insider. If you're looking for more information, if you really want to be that specialist for your current clients and attract more individuals who need and want your expertise, check out the link that's associated with this video, either above, below, or the side, depending on where you're watching it. Check out the Integrative Corrective Exercise Instructor program. It's designed to help you be the specialist to work with your older adult population, the active aging population, those clients that have medical fitness issues, osteoarthritis, hip issues, knee issues, things like osteoarthritis, balance issues. Check that course out. It's a 3-day intensive course where we teach you the functional anatomy, the assessments, the corrective exercises, and show you how to plug it into the programs that you're already using with success. Make it a great Sunday, and we'll see you next time at Integrative Movement Insider. Take care.